I'm Jen Budney with the Canadian Centre for the Study of Co-operatives at the University of Saskatchewan, and I am delighted to have with me on the other side of this Zoom call Colleen Christopherson-Cote from a number of organizations, social economy organizations, community-based organizations here in Saskatoon, and we're going to talk about the work that she does in coordinating lots of different partners in the in community organizations and government, and also the response of the social economy in Saskatoon to the COVID pandemic. So welcome, Colleen. I think you can probably do a better job than me at explaining what you do.
Awesome. Thanks so much for having me, Jen. Yeah, I guess, the background piece for me is that I've been working in Saskatoon now for about 7 years as an independent contractor, but in a series of different partnerships. And so over that course of those 7 years, I've been tied to things like the Saskatoon Poverty Reduction Partnership that looks at 12 bold ideas to eliminate poverty in Saskatoon. Previous to that, I was also involved with Early Years Partnership that was really looking at things around childcare and support for families with children 0 to 3. And I do some work in the Safe Community Action Alliance, which is a team that is focused on the health and well-being in Saskatoon with a specific focus on housing, homelessness, and the crystal meth crisis that is happening. And then I do some other contract work that is all tied together in eval. So some community-based evaluation for homelessness. I do some systems mapping, which is a modification of a value stream mapping process, which is many people will know from a lean world. And so we took attributes of that and looked at a mechanism to do complex human service mapping. And then I do a lot of collective impact work, looking at how you do community development work through a collective impact and a constellation model so that you can untangle and unpack complex social issues, look at program and process, but also talk about policy change.
So you wear a lot of different hats, and as we were just discussing before this interview started, you are involved with a lot of organizations that have a lot of different acronyms. And, I imagine that this, you're sort of in the middle of a big web.
Yes.
In community in the city of Saskatoon, and I'm wondering if you could describe a little bit the importance of having people like you in this web, or building this web even.
Yeah, so I mean, Saskatoon, if I'm thinking about like how people have been asking us, how have you mobilized community to respond to COVID? It's because that web exists, and it's because people know the channels to connect through the web. And the interesting thing when you work in a collective impact way or in a constellation style of governance, the reflection around third-party coordination becomes really, really important. And the thing that third-party coordination does and allows me to situate myself as is an independence. I don't have a power imbalance necessarily that I would if I was a funder or came from a large sector or was government. And so we can, as independent contractors or folks who sort of sit in the middle of the web, we can recognize points of contact, and we can recognize conflict and barriers, and we can find mechanisms around them, and it's all rooted in relationship. And so building that relationship framework is the critical piece to moving this work forward, and that's what's, as an independent contractor, that's what my business is, right? And so third-party coordination is a critical piece to moving that work forward.
So before we jump into what's happened with COVID, you used two really interesting terms that I'd love to have you explain a little bit more. And the first one was collective impact. The second one was constellation governance. And I'd love to hear a little bit more about those two ideas.
Sure. So I think when I learned about both of them, I learned about them independently. And then as things emerged, particularly with the Poverty Reduction Partnership, I realized that I was taking the best of both worlds and making my own sort of version of what it could look like for Saskatoon in that work. And so collective impact, I mean, people can Google it. There are lots of research papers and lots of folks doing that kind of work. It has 5 core priorities. The thing about it is that it's only effective if you're working on a complex social issue. And so you wouldn't build a complex collective impact model style of community development if you just had a very easy problem to solve. And so we're using collective impact as a mechanism to unpack and figure out how to alleviate or eliminate poverty. Poverty clearly is a complex social issue. Crystal meth crisis, also a complex social issue. There are pieces inside those complexities, though, that don't require a collective impact model. And so when we start talking about how we do the work and what governance looks like, the constellation model lends itself nicely because what it does is allow people to congregate around energy. And so there aren't a lot of rules and rigidity around governance structures, and there aren't a lot of rules around mandate other than the common agenda, which is part of a collective impact model. And so what we've done is taken the common agenda, shared measurement, mutually reinforcing activities, consistent communication, and a backbone agency, which are the components of collective impact, and said, what would it look like if we opened up the governance structure and allowed people to work under the common agenda in a way that they were free and nimble to do so based on what their energy drove them to do, rather than saying, we want to work on this part of income and then trying to find people to do it. We let people come to where their energy and passions happen, and people who are empowered to work on the things that they're passionate about will work on those things, and people who don't want to work on something just won't work on them. So why are we forcing people when there are so many things we could be working on? And so we really try to make sense of the collective impact model and tie it to energy and resources in a way that is less confining, more nimble, and more empowering around passion and people.
Mm-hmm. And so you've used that with the Saskatoon Poverty Reduction Partnership, but is that also an approach that they're using with the Safe Community Action Alliance?
Yeah, it is. And so clearly health and well-being is a complex social issue. And again, there are pieces within it that aren't complex and would be a quick fix. And so those pieces we would identify and work on in a different way. But underneath the big sort of umbrella of the way the Safe Community Action Alliance is working, we've really adopted that constellation model style of governance we have 2 coordinators, myself and Bonnie. And so we're the third party coordination. And what our job is inside the constellation model is to catalyze, convene, and coordinate energy around core ideas or projects or process, even policy, that are identified by a larger group of people. And so the big Safe Community Action Alliance team, I think there's about 55 or 60 folks now at that table, set some priorities around a common agenda. So they've identified, I mean, there's a million different themes or sectors you could be working on from safety and well-being, but they identified crystal meth and housing as core priorities. And so underneath those 2 big headings, what could we do and how do we convene teams and what do we work on? All of that work is driven by the partners, not by the coordinators. Mm-hmm. So we just, if I think back, one of the partners from police service describes the crystal meth work that we did recently, that they built this giant pot of stew, and it was my responsibility to reach into that pot of stew and pull out the pieces that were edible. And we built this lovely thing from this chaos that is what the work will look moving forward. And again, it's also complex, but we actually have a fairly decent framework now where we can set priorities and move forward. And some of it is quick fixes, in the land of community development, quick fixes, and some of it is like complex policy change.
Right. So hopefully we're going to be able to provide links to documents from these organizations at the bottom of our YouTube post. But could you, and now if you've got 50 or 60 people sitting around the table, you can't list all of the partners in the Safe Community Action Alliance, but for people who are unfamiliar with it, can you give me a general sense of who's sitting down at the table together and why this is so unique?
Sure. So it's funded, so SCA, the Safe Community Action Alliance, is funded in a similar way that other collaboratives are funded. in that it's a pooled set of resources. And so right now resourcing for the work comes from the City of Saskatoon, Fire, Police, Health. I'm going to forget somebody. I'm sorry, I forgot you if I forgot you. Around funding. And so then we pool those resources, and there's a smaller team that manages the contract and the abilities of the coordinators to meet mandates. But then the other folks bring resources and human resources and in-kind supports. And they're the ones, like, money is important, but the piece that we often lose track of in community development is the investment of time and energy and human resources to move work forward. And so the bigger group is Saskatoon Tribal Council, and so they are also a resource contributor and a supporter of the administration part. And then in all the pieces within STC, the Tribal Council, that health and justice and all their departments, but also the Health Authority and all of their folks, from health promoters to primary care folks, and all through the sort of gamut of what health is. The university is at the table, and so at the big table, the main table is like the president's office and leadership inside the university. And then within action work and other pieces of it, we have faculty and staff and administration and students, and making sure that research, community-driven research, is done in a mechanism that's ethical and supportive, but also can be used by community-driven researchers at the university for actual research. And so university, and then there's a bunch of community-based organizations or agencies, Food Bank and Learning Center, Friendship Inn, Aid Saskatoon, the Lighthouse, Salvation Army. I'm going to miss a whole bunch of folks, but all those sort of, some of them are crisis intervention services, some of them are more upstream, policy-driven, community-based organizations. Some of them are very specific and have very specific mandates, and some of them are more vague. And then there's governments, so municipal governments, tribal council, like I said, and then provincial government has representation in that work as well. So Ministry of Justice, Ministry of Social Services, Ministry of Health, Ministry of Education, the school divisions. So they're all involved in the complexities of unpacking what it means to have a safe and healthy Saskatoon.
So that's quite a remarkable alliance that has been created, and it seems to me that it's a real innovation for Saskatoon.
Yeah, and I often, we talk about it outside of Saskatoon often, and people are kind of maybe caught off guard by how diverse the voices are at that table. And I go back to the third party coordination piece, right? And I think if I reflect on what's been going on with COVID, and the way that systems have historically been built around colonial hierarchy and power, the thing that third party coordination takes away from that is that I don't hold any of that power, and I don't have any of those agendas. And so it's easier for me to go in as an independent contractor and have a conversation with all the folks who generally have turf and power conflict when they are not the leadership of the conversation. And so I can unpack things, or I can park things, or I can have side conversations prior to meetings to make sure that I understand what the power dynamics are and where we want to move this work forward. And because we're driven by a common agenda that we've come to as a collective, we can always go back to the guiding principles around that common agenda. And so we set that groundwork up right away and say, this is who we are, this is who we agreed upon as a team that we will work like, these are the things that guide us, so that when there is conflict, we can go back to those statements and say, the thing that we're conflicted about, is it aligned with the things that we said we were going to work on? If it is, then we need to unpack it and figure out how to get through it. But if it isn't, we need to let it go, because it's not welcome at this table.
So it's not just a working group, but it's also an ongoing negotiation table in a way.
Always, yeah.
Yeah, okay. And
yeah.
So, from my understandings of negotiation, having those principles, operating on the basis of principles rather than positions, seems like, especially for complex negotiations, always is the best way to move forward. So this makes sense to me, how this operates. There's a lot of talk in policy circles about network governance. And I've read very little in the public policy realm about this constellation governance, but this idea of having an independent contractor in the middle makes a lot of sense. And I don't know how you avoid those kind of anchoring of positions and the power struggles without that independent coordinator.
Mm-hmm. Yeah, I've been involved in in community development examples where there hasn't been an outside coordinator. And what ends up happening historically is that the folks who have the most power drive the agenda. And that power generally comes from funding. So if you have core funders, particularly if those funders hold the bulk of the amount of money being contributed, then generally speaking, they seem to be able to execute more power. And sometimes it's like not overt, right? And so at the end of the day, you're like, how did we end up here? And then you could reflect back and you're like, oh, we ended up here because the funder, and it's not malicious, it's just the way that they have a mandate and they need to be accountable and all those pieces. And so it's not that we take accountability out, it's that we spread it over a variety of different voices.
That's fascinating. So the Alliance came together to, at first, to deal with, the first big project you took on was to create a report on dealing with the crystal meth crisis in Saskatoon.
Mm-hmm.
But almost immediately after you released the report, we were hit with the COVID-19 pandemic. So what did this cause you to do? If you had to shift gears, I imagine we all shifted gears. And how has the pandemic impacted the nonprofit social economy sector in Saskatoon, would you say?
Yeah, so Bonnie and I were working, it was like maybe a handful of hours between the release of this massive report and the conversation about COVID. And Bonnie was she was thinking about, if COVID really closes the economy down and the service and the human service system down, that's going to leave a lot of vulnerable people without anything. And what happens to those folks if we don't start really thinking about them? And so we reached out to a couple of key vulnerable sector service providers in Saskatoon that were tied to the Safe Community Action Alliance and said, hey, is there an appetite to have this conversation, and would you like us to facilitate it? Because again, we're talking about third-party coordination, right? And the freedom to be able to speak clearly and not have power play a role or judgment or the things that were going on early COVID around you're closing your service and people were feeling shame and blame and all those kind of pieces around, the fine line between providing service to vulnerable folks and keeping your staff safe. And so we opened those conversations up and were maybe kind of caught off guard by how quickly people wanted to do something and how quickly people let down their conventional ways of working and knew that they needed to pivot in a way that supported their staff and kept them safe, but also provided services to the most vulnerable people in Saskatoon. And what did that really mean? How do you define vulnerable, and who are these folks, and what do they really need access to, and what services and what frameworks can we look at to set some boundaries? Because again, there's millions of different things that you could do to respond to this. And so slowly we started having more and more meetings, and Bonnie and I realized quite quickly that we were having a hard time using collective impact and constellation model style of work in a crisis. And so I don't actually even really remember how it happened, but this shining light was handed to us that is emergency measures folks. And the EOC, the Emergency Operations Center for the City of Saskatoon, offered some supports and said, in a time of crisis like fire and flood evacuation, we work in an incident command structure, and it's hierarchical and it makes sense out of chaos. And Bonnie and I are like, nah, it's not how, we don't work in a hierarchy. We don't want a boss. We don't want to build that structure. And they're like, well, here's how it works. And they were very lovely around teaching us the pieces of it. And slowly we thought, okay, well, that makes sense. It would make sense if one of us was doing that piece and one of us was doing that piece. And sort of over time, it evolved into this command structure. And so in the very beginning, I would say, I think we're classifying day one as around March 17th. It's now, what, May 21st? We have gone from a preliminary conversation around an incident command structure to a fully functioning incident command structure framework that has 35 command and general staff. We have essentially built an organization, a comms system, a mechanism for developing content and research, and a funding model. And so we reached out to some core funders in town and said, we need a mechanism to funnel some money into this through donations in a way that's nimble enough to get money out the door as quick as possible, because we need things like PPE, protective equipment, and folks need food, and we need to support some staff, and we need to build a hub, and we need to respond to all these things that are going on. And they stepped up, the United Way and Community Foundation stepped up and opened a portal, and we've been raising money and moving money from a system that's also an incident command structure system called a 401. I don't actually know why their forms all have numbers, so I don't really know why it's called a 401, but it's called a 401. And we've adapted that 401 process that would normally be used in a command structure around fire and flood for situational awareness as a mechanism to collect situational awareness, but also for community agencies to identify need, to ask for funds, to ask for supports, to tell us if there's like a bad thing coming, emerging themes, all those kind of things. And because we knew there's going to be a lot of data, we quickly embedded a research team. And so the university has been part of that conversation right from the get-go. We hired some students and have some faculty supporting those students, and we've been creating aggregated data sets ever since day one. All of those things came to be because the web that you talked about earlier existed, and because Bonnie and I have spent a year, and me more, building trust in the web connections. And so it's not that it's not without conflict, there's always conflict in complex social issues. But the underlying trust in the community and the support from the team allowed agencies to drop barriers, to say, we're going to work together. So one agency says, I normally have 10 staff, but I only have 2 that are second to this work. And another agency says, well, I have 2 more. And so then we actually have like co-seconded staff from a variety of different agencies working in another agency's space to deliver services. Yet all those agencies are funding their staff out of their own operating budgets.
That's incredible. So when I hear about this transition to a hierarchical command and control situation to deal with a crisis, it sounds like on the one hand, that's something government could do. But when you talk about the trust that's necessary for all these organizations to work together as effectively and as efficiently as they do during this crisis, it doesn't sound like that's something government could do.
Yeah, and I think that's the one thing that we're struggling with right now. So we're in a bit of, if I dare say, a lull. We're definitely not out of crisis mode, but we're
warning us that we should expect the second wave soon.
Right away, yeah. So the data is clearly indicating that that's coming, but that doesn't mean that we're going to actually go back into the state of urgency that we were when we built this, because it's actually kind of built, right? And so we know what we're going to do and how we're going to respond. And so right now we're just trying to figure out, as other parts of our pre-COVID work starts to emerge, and as people who were seconded to do the work around the urgency of COVID go back to their other jobs, how do we go back into the other world, the non-COVID world, and not lose track of the amazing things that happened through this process? Because we know that a lot, including government policy, a lot of red tape was cut through instantaneously. Community and government, federal, municipal, all levels of government, municipal, provincial, federal, and tribal council. They all came together and had a conversation. Not necessarily together, but they all had a conversation around, like, what are the things that are holding this process up, and can we alleviate those in COVID times? And so our question now is, as we emerge out of COVID and we go back to talking about crystal meth and poverty and homelessness, why can't we also talk about those things from a social perspective as also a pandemic? And why is there not a sense of urgency to alleviate or eliminate poverty like there is to alleviate or eliminate COVID?
Mm-hmm.
And why is there not an urgency to eliminate overdose in Saskatoon? Right? So more folks are overdosing in Saskatoon in COVID times than are dying of COVID. And so it's not that we don't want to work on COVID, because I understand why we're working on this, but it shouldn't be at the cost of other sectors or other demographics. And we shouldn't then also emerge out of this and go back to allowing the barriers and all of those pieces that hindered our work pre-COVID to just be reintroduced.
So are you hopeful then that policymakers will have learned a few lessons from this COVID experience in their work with the third sector, with the community organizations?
Yeah, I'm hopeful. I'm also hopeful that business, like we've had a lot of really interesting conversations with business, particularly in the reopen strategy, that we have never had before either in this sector. And so the interesting thing that we've been sort of trying to articulate, and we've kind of always been articulating it, but maybe not in an effective way, or maybe not in a way, or maybe the people that we were articulating it to just weren't ready to hear it the way we were saying it. And so COVID has actually changed the landscape. Bonnie and I talk about the fact that in fact, emerging out of this, we're rewriting and it's a new social contract. And the social sector actually is gaining momentum in the agency or sector to be trusted and to go to. And so we've seen government agencies coming to us inside the interagency response and asking us, how did you do this? Can you provide us with a framework? Can we work together so that we can do that here? You know, what would it look like if we did this? Could we change the policy here? And so those conversations never happened pre-COVID. We would always be going to them and saying, hey, can we do this? And that reversal has started to happen. Mm-hmm. And I think the one thing that government, I think they understand it because they do it, but they don't really understand it, is that community agencies can do things better, more efficiently, more effectively, more promptly. And so why not invest in community organizations to do that work? The breakdown historically is that they just don't invest. They just dump it on us, we do it, and then we figure out how to resource it inside our community. But what we're saying to them is like, yeah, we can do it, but you need to resource it. And it's actually cheaper to resource it through community than it is to resource it through government. And so I'm hoping those conversations will emerge out the other side where we have a better understanding of how our sectors overlap and how we can work together to be more efficient.
So I want to talk about your hopes and fears, and I know we don't have much time left because you have more meetings to go to, but let's start with the fears so we can end on a more positive note. But what are your worries about what communities face on the other end of, and community organizations face on the other end of COVID-19?
Yeah, so I mean, ultimately it's about burnout and being tired and the fatigue that agencies are feeling. So generally speaking, I work in systems level conversations, and I have been catapulted into frontline conversations. And every time I'm catapulted into those conversations, I'm reminded how exhausting the fight is to navigate and advocate through barrier-laden human service policy systems. And adding COVID on top of that is just exasperating that workload. And so folks who work in a vulnerable sector, their clients or their visitors are often have health related stresses, and they're used to seeing their folks pass away, but they're not used to the demand on services and the potential for death that comes with COVID. And we are working as hard as physically possible to keep COVID out of this demographic, because if it takes hold, the amount of loss will be like, we can't barely even articulate what that will amount to. And so that is probably the biggest fear, is that we let down our guard even a little bit and the virus takes hold in this demographic.
Mm-hmm.
Yeah.
What would you like to see coming out of this in terms of policy response or government responses, funding, direction of funding? What three main areas do you hope to see get more and better attention at the end of this?
Yeah, so we always talk about, I call it the golden triangle. So income, food, and housing. So if we talk about those three things, people can get, and people will move towards other social determinants of health supports if income is equitably distributed, if they have a safe and secure place to live, and if they have enough food. And so that's what the interagency response in Saskatoon focused on, those three pieces. And so I would really like to see, and this is one of the things we've been talking to business about, is that the cure to getting homeless folks out of the downtown core in Saskatoon isn't blaming a service agency for its presence in the downtown core. The cure to getting folks out of homelessness is actually housing. And so can we have a conversation around whose responsibility it is to secure housing? What are the limitations around people to get access to permanent housing? What is the role of the social housing complex inside our province, which is the housing authority, in providing access to safe, affordable housing for low-income folks when there are thousands of vacancies in this province? And thousands of homeless people. It doesn't make a lot of sense that those two pieces are not connected. And that people need to have support when, particularly folks who have a really high acuity to homelessness and have spent the bulk of their adult life homeless. You can't just catapult them into a space and say, oh, there you have a new house and it's all good, and walk away. And so how do you then wrap supports around, and what is the harm reduction support that you would wrap around those folks to ensure that they're successfully housed, and how do we fund that in an equitable way so that people who need more supports get more supports, and people who don't need as many supports get what they need as well. And that we start breaking down the barriers around shame and blame for folks who might need substance use supports versus mental health supports versus physical health supports, etc. And so who can run those programs the best? How do we fund them? And how do we recognize that housing providers have an obligation to allow those services on their sites? And then that would then flow into the idea that people then need to have equitable access to income. And so you have supports for housing, and people then can start getting an income. And as people get more stable with wealth and the ability to build assets and to support themselves, then they will venture out into other parts of community, right? They'll search out employment, they'll search out mental health supports, they'll do all of those pieces. And then food for us is a bit of, there's a piece around meal access, but there's also a hamper access. So those are emergency services. But then how do you build capacity in people to know what they need to buy and how to buy it and where to buy it, and how do you give them access to buy it? And so those are tied to other things like transportation and family dynamics and those pieces. And people need access to food in their communities. That was the one thing that COVID showed us very quickly. If you need to self-quarantine and isolate in your home, and there's no grocery store within 10 kilometers of your house, how do you do that? And so delivery of food, and they don't have the capacity to order online and have things delivered, right? And so we stepped up our delivery, and the tribal council stepped up and said, like, folks need access to groceries and food, and we're going to deliver those to them. So now that we leave COVID's urgency, those folks still need access to food. They may very well be able to leave their house and go somewhere, but what does it mean to have a food source in your community, right? And what kind of food can you give access to in your community? So I think for me, talking really specifically around the policies across the ministries and across even municipalities around, you know, what are the barriers to income, affordable housing, and access to good food. Those are the three that I would say are the top three priorities.
Good. That was a lot. I want to thank you so much, Colleen. I don't know if you have anything else to add or if you just need to run on to your next meeting. But that was I learned a lot from our conversation, and I want to thank you for your time and for all the work that you're doing.
Awesome. Well, thanks for having me.